Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about inositol, the impact on hormone regulation and blood sugar management. Inositol is known as B8, and let's get right into the facts. So, inositol is a constituent of phospholipids that make up cell membranes. It mediates cell signaling in response to hormones. So it's a secondary messenger for hormone signaling. It's essential for tissue growth and proliferation, so normal tissue growth. It's abundant in the brain, nerve tissue, and important for serotonin and dopamine production as well as utilization. Again, inositol is B8. Oftentimes we talk about B6, B9, B12, but it used to be called B8 until they realized that the humans can actually produce inositol. So humans can produce approximately 4 grams of it. 2 grams of it can be produced through the kidney, and usually about 1 gram is through the diet. The main uses for inositol or myo-inositol is for metabolic conditions such as metabolic syndrome, obesity, diabetes, and so forth. Hormone and reproductive remediation, such as infertility, PCOS or polycystic ovarian syndrome, as well as neurological conditions. As a matter of fact, when they do some studies, they've seen that patients who have cognitive decline like Alzheimer's or traumatic brain injury, they actually have lower levels of myo-inositol in their brain. So what is it? It's a sugar alcohol. It has a sweetness about half of table sugar or sucrose. Myo-inositol and D-chiro-inositol are the two main forms. And some studies say that in a ratio of 40:1, 40 myo-inositol and 1 D-chiro-inositol is the proper ratio or the most effective ratio in utilization or helping these metabolic or neurological conditions. So it's good for glucose metabolism, it helps insulin sensitivity, and it's just as effective or more effective really than metformin because it actually doesn't have the side effects that metformin might have. So metformin is a drug that is used for diabetes to improve insulin sensitivity, and it's used, pretty broadly worldwide. So if you want to improve insulin sensitivity and that you're in that pre-diabetic range or early diabetes, adding myo-inositol may be a good adjunct to metformin. So you can probably use metformin and myo-inositol together to have a better impact. PCOS or polycystic ovarian syndrome. If you really look at PCOS, there's issues with insulin surges as well as testosterone levels, and it's been known to help regulate that. Infertility. It restores FSH or follicle stimulating hormone, and LH is luteinizing hormones. These hormones are actually produced in the brain, and it impacts the ovaries and the testes. So follicle stimulating hormone and luteinizing hormone impacts ovarian production of eggs and so forth, or the health of the eggs, and testes, right, for testosterone production and so forth. So hormonal regulation can be also reestablished or restored. Panic attacks and depression. So they've also used therapeutic doses of myo-inositol to help improve kind of brain-related disorders, right? Anxiety, depression, panic attacks. It's been quite beneficial for that. So these are the major conditions that they would help for. In terms of dosage, you can use 1,400 to 2,000 milligrams twice a day in order to help with some of these conditions. Now you can go even higher, up to 12 grams a day, but some side effects have been noted when you're using high doses. Mostly GI upset, nausea, sometimes vomiting. But these are the typical recommended dosages in the studies. Now, foods high in myo-inositol. Fruits such as orange and cantaloupe have a lot of it, and then beans, nuts, and grains also. But those are the more of the phthalate formation, so it has to be converted. However, myo-inositol is produced through the body, and lower levels can impact those metabolic syndromes and neurological conditions and so forth. So if you've never heard of it, it might be worthwhile for you to take a look into it and look at some of the studies that I will link below this video in the description. All right, my name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.